Do you think people with mental health problems should receive support from the state?
Yes, I do. I do. And really and truly, there's a lot more care could be given to them, I'm sure, because there are a lot of people getting help which could really do without it.
Yeah, I don't see why not, as long as, like you say, they've got justified cause.
Yeah, I mean, it's not something, they've asked for or they've done to become like that, so why shouldn't the state help?
Definitely, unquestionably, yeah. And I'm quite happy some of my taxes to go in that direction. Yeah, definitely.
Help the people, They need help, they need the care.
Oh yeah, definitely. I think it shouldn't be fair to just ignore them. They should definitely get as much support as they need.
Yes, definitely receive help from the state. Yes, definitely receive that, yeah.
Yes, I do, definitely. Definitely. Oh yes, yes. My son also messed with drugs and we couldn't get any help for him unless he wanted help, which he wasn't in a fit state of mind to ask for help. It should be in the hands of someone who is related to the person to be able to say, right, he needs help, I want help, and it should be up to the National Health Service to provide it, because we do pay our contributions.
I do, yes. I think there's a lot more support that's needed, definitely. Yeah, it's very important.
Yes, I do.
Yes, I think they should have support from the state, yes, definitely.
Of course they should. They want us to go out to work, so why shouldn't they help us out to get back to work?
Yes, I think they should get all the help they need. Not obviously treated differently, but obviously the help that they need to get better.
Yes, I do. Yeah, definitely, 110%.
Yeah, I think they should be supported 100%. Otherwise, we would be in a serious problem, all of us, because they can cause a problem to everyone.
Absolutely.
Yeah.
Absolutely.
Okay.
I don't see why you saved all your life, you've paid taxes, you've planned for your old age. Well, their mental health doesn't come in the old age always, does it?
No.
But you plan ahead, and then all of a sudden you're paying out huge bills.
Well, I think that they could do more. I mean, I'm lucky. I've got a big family, so my family was very supportive. But I think the state could definitely do more for mental health.
Yes, definitely, because it's not their fault.
1 in 4 of us at some point in our lifetime will suffer from a mental health issue and need some help.
Do you know anyone who suffers from a mental health problem?
I've got people in the family, and I belong to the local Rotary Club, and we do a lot to help people in that situation.
Well, I do, but I mean, I just know them by sight, and if I see them and they're alone, I'll go and talk to them, and I find it very sad. I think they're looking for people to converse with them because they feel a bit out of it all, and really and truly it could happen to anybody.
No, I don't know. Not now. I used to, but he died. He passed away.
I do know somebody who's got a mental health problem. They've got, I believe it's called schizophrenic, I believe they're called, the little voice inside their head. But like I said about the curious, I gave them benefit of doubt and they was absolutely fine. So.
Yeah, I've worked with a couple of people, especially in youth groups like the Army Cadets and stuff, with people with mental health problems.
I've had depression caused by this system, yeah?
Right.
It's cause and effect. Where there's love and there's friendliness, that stuff can be dealt with and got over.
Well, I know 2 people who have dementia.
Well, did you include depression and things like that? Yeah, I do, yeah, one of my family.
I know many people in Huntingdon because I used to work for with the people with learning disabilities, so I do understand a lot of things anyway.
And me?
My uncle. He has, it's a medical issue with the side of his brain when he was in a car crash and he's become mentally ill and he's has fits.
I used to know them in Africa, but I haven't met anyone here now.
No, I don't, but my mother used to be a carer for people with mental health issues.
Oh yes, I know some people with mental health problems.
Well, my mother-in-law,
Yeah.
yes. And I know of people, my husband's in Rotary, and that brings it to the fore quite a lot, yes.
I myself had a nervous breakdown about 15 years ago. I had a lot of support from family, neighbours and hospital, and that's part of care of community. We look out and help them rather than abandon these people.